The referendum on the rule of Venezuelan President Nicolás Maduro. They say he needs to go.
For the last few years, turmoil in Venezuela has been a regular item on the news worldwide. Two politicians are claiming the presidency and the economy has collapsed. Stores are empty and people are suffering due to poverty and hunger. Because of this, some people fight, while others decide to leave. Since 2015, over 4.5 million people have left the country. But where do they go? How do other South American countries deal with this mass migration? For example, what happens to the people who walk all the way through Colombia to Ecuador? Can they find shelter? Food? Can they find work here? Do they get access to basic healthcare? In other words, do they have the opportunity to start a new life in a different country? Ecuador is the fourth smallest country of South America. Its mainland is composed of three distinct regions. El Oriente, the eastern part of the country housing the Ecuadorian part of the Amazon. La Costa, the western part of the country that is the Ecuadorian coast of the Pacific Ocean. And La Sierra, the highlands of the Andes mountain range which extends from the north to the south. In it lies the capital of Ecuador, Quito, a city with a population of 2 million people. In the past, Ecuador was mostly run by left or socialist leaders. One of the places where this is still really visible is in the healthcare system, which guarantees basic healthcare for all.
Well, here in Ecuador, in our health system, we have two types of it. We have the private one and we have the public one.
The Ecuadorian healthcare system, well, it takes care of everyone who needs it. So I mean, even if you are not Ecuadorian and you need help in it could be a hospital or a health care center. You can, they need to give you attention, and they will give you attention.
And it's free for all, right?
It's free for all, yes.
Because all the Ecuadorians have to do a month payment that we call Seguro Social. Okay, all of us has to pay. Even if you are not a public employee, if you are a housemaid, a housewoman, or even you are a volunteer who is not working, you are almost obligated to pay for the ES. Even if you can pay only $5 a month, you will have a public service, okay? You are allowed to use it. But when you have a really extremely necessity with a specialty and you go to the hospital, you don't get that kind of service. I also have a daughter who has a disability and she has a cochlear implant. It costs almost $4,000. Okay, 4,000, and it was covered by the security, and that happened 6 years ago. Okay, and I change her cochlear implant every 5 years. So maybe I'm using the public service, the healthy service, and maybe it is worth because my daughter needs.
As we hear, the Ecuadorian healthcare system is based on a system in which the people who earn more have to pay more. Out of this Seguro Social, the basic healthcare is covered for all. But if you need specialist care, you will have to pay extra. What do Ecuadorians think of this system?
Yo pienso de que, o sea, igualdad no, porque por ejemplo aquí siempre preferencia para la gente que tiene plata.
Bueno, yo pienso que el sistema de salud está muy, o sea, para mí, en lo personal no me agrada porque yo a veces tengo chicas que trabajan conmigo y van a los centros de salud y la atención es pésima. Y en la medicina no hay lo que le mandan en la receta, solamente le dan lo que brinda el seguro. siempre es esa pastilla paracetamol, nada más, nada más.
Bueno, aquí en nuestro país propiamente, en cuanto a la salud se refiere, los gobiernos de turno se han preocupado, no un 100%, pero sí un 80%.
Basic healthcare is covered by the Seguro Social, not only for all Ecuadorian people, but also for all foreigners, including all the Venezuelan migrants who do not pay for it. Does this higher demand bring challenges to the Ecuadorian system?
And I worked in a healthcare where there was not so much people from Venezuela, and I didn't really realize how it impacted on the system, on the healthcare system. But I have some friends that work at the hospital, and they say that in the 2017, okay, when the Venezuelans came in very large group of people, so when in that moment, in that year, there was that actually hospitals were kind of crowded. They were really crowded, and almost of the 100% of attentions by day, like 75, no, more of the 50% were Venezuelans in hospitals and in healthcare centers, like the types A, B, and C. Because here we have type A, B, and C. The first level is type A, and the B is bigger. So they work like 12 hours, and at the C they work 24 hours. But in all those levels there were Venezuelans, a lot of Venezuelans.
Do you think that the government has enough resources to provide for all the additional Venezuelans that have come into the country?
Of course not. If they cannot afford all the Ecuadorians, even worse with Venezuelans, even with Peruvians or Colombians, we are not ready to cover them, to help them. We want to help them because they are our brothers, but we can't.
Here in our region, we treat the same. There are even Venezuelans that are like more charismatics than some Ecuadorians, and they actually wait, and they understand that they need to wait and that they need to follow the protocol to have an appointment. And there are some Ecuadorians that actually don't do that.
In Quito, we went to a shelter for refugees, where we spoke with Venezuelan migrants and volunteers. How do they experience their migration to Ecuador?
Mi nombre es Jorge Escobar, yo soy psicólogo y vengo aquí de voluntario a aportar en el apoyo psicológico a la gente, el apoyo emocional, porque mucha gente tiene el hecho de venir, salir del país, conlleva primero un trauma, tener que en las condiciones que llegan, venir caminando desde Venezuela hasta acá, son varios cientos de kilómetros que recorren.
Buenas tardes, mi nombre es Gilgu La Rosa, tengo 32 años, vengo de Venezuela, vengo de la capital, Caracas, y estoy aquí como mis demás compañeros, siendo un migrante más de Venezuela.
Buenas noches, mi nombre es Víctor Campos, tengo 18 años y vengo de Anzoátegui, Venezuela.
¿Por qué saliste de Venezuela?
¿Por qué salí de Venezuela? Bueno, decidí salir de Venezuela porque en verdad no tenía recursos para alimentar a mi hija, para alimentarme a mí mismo. Se me cerraron las puertas, tengo dos profesiones, soy carpintero, soy albañil y en realidad no hay trabajo. No hay...
Bueno, era estudiante, pero como al último ya mi papá estaba enfermo, decidí ayudarlo a trabajar.
¿Tu familia todavía se quedó en Venezuela, tu hija? ¿No?
Mi hija está ahorita en Perú, está con su madre.
Porque iba a Perú, pero cuando iba a Perú, en el viaje cerraron la frontera y no tenía visa y me tuve pues que quedar aquí. Porque regresar no es alternativa.
Como lo dije, para ayudar a mi familia, porque en muchas circunstancias tengo dos hermanitas, una de 15 años y una de 3 añitos. Decidí salir de Venezuela para trabajar y ayudar a mi familia.
In January 2019, public opinion turned against the Venezuelan migrants after a Venezuelan man killed a pregnant Ecuadorian woman in the streets. Groups of Ecuadorian people protested against the presence of Venezuelan migrants in Ecuador, causing some Venezuelans to flee their new homes. Do Venezuelan people still feel safe in Ecuador?
Es como todo, sí he sentido discriminación.
En comparación del país donde venimos, sí es seguro.
Me siento bien, siento que es un país seguro. Hay muchas personas que me han tratado bien.
Y llevan un teléfono en la mano y lo esconden como si tú se lo vas a arrancar o se cambian de cera. Pero también han habido personas que te tienden la mano, hablan contigo. Pongamos un 50 y 50.
Do you think it's less safe now in general?
Well, I always have this thought that that evil doesn't see nationality. So I mean, if there are bad Ecuadorians, there are bad Venezuelans, there are bad Netherlands. There are.
As we can hear, different people have different thoughts about this migratory problem, and others don't deem it a problem at all. After all, it's like the Dutch say, a good neighbor is worth more than a distant friend.